The modified Unna boot is an effective, semi-rigid conservative intervention that will result in a reduction of lower limb girth. The dressing is a low resting pressure, moderate working pressure device. To clarify, the Unna boot is only the paste layer. The addition of the short stretch cohesive bandage outer layer makes the dressing a modified Unna boot. Use of the word boot is a bit misleading, as the dressing is essentially a gauze fabric impregnated with a zinc oxide gel. You may also find the product containing calamine lotion to reduce inflammation topically. At rest, the dressing provides a very low level of compression. However, during exercise, the semi-rigid quality of the product provides resistance to the calf pumping action in the lower leg, which increases blood flow velocity and venous return. The dressing itself does not absorb wound exudate, so if there are wounds present, an appropriate dressing should be applied to the wound prior to application of the paste bandage layer. Before applying any type of compression device, it's essential that a vascular exam be performed to assess the patency of the arterial perfusion of the lower limb. Because there is no resting pressure in the dressing, a low ABI is not a contraindication to use of the modified Unna boot. In addition, it's always advised to perform a thorough skin inspection prior to application of any dressing. After inspection, the person is positioned with the knee and ankle flexed at 90 degrees. It's important for them to also actively dorsiflex the ankle so that the anterior tibialis and hallux extensor tendons are prominent during application. This will reduce the potential for a pressure injury to develop over the tendon. The paste layer is applied in a circumferential pattern. However, depending upon the shape and girth of the calf, you will have the best result if you allow the bandage to follow the contour of the leg rather than trying to minimize the wrinkles by proceeding in a strictly distal to proximal fashion. Apply the bandage up and down the leg, ensuring complete coverage using the entire dressing, which is about 5 yards long. You may notice that I occasionally make pleats in the dressing to manage the material, since wrinkles will form where the calf muscle bulk transitions to the tendon, which affects the shape and girth of the calf. One thing that makes this a little bit easier is just to warm up the dressing in the microwave for about 15 seconds. It's more comfortable for the patient, and it's easier to work with the paste if it's been warmed up a bit. Although it appears that I'm applying a good amount of compression, realize that there is no elasticity in this product, so that it is applied intimately, but it's not applying compression at rest. Here I'm applying the cohesive bandage. You may occasionally in the community see clinicians using an ACE wrap or a long stretch bandage over the paste wrap. This is not appropriate, as it defeats the whole purpose of this being a low pressure bandage system. After application, it's recommended that both the comfort and the capillary refill of the toes be assessed to ensure that the patient's circulation is tolerating the dressing when applied appropriately. The dressing should feel snug and comfortable. The dressing should be inspected on a regular basis as well to ensure that it's not descending due to girth reduction. If this occurs, it should be replaced. The frequency of dressing changes will vary with each patient, from as often as a few times per week to weekly, depending on the amount of wound exudate, girth reduction, and comfort of the patient. Once girth reduction plateaus and/or the wounds are healed, patients may be transitioned to long-term edema management products. Thank you for your attention. I look forward to speaking with you again.